Hi everybody, my name is Mariam Treystman from the Home Health Consultant, and I'm here to teach you a little bit about the government structures of the home health and hospice industry. We are located in California, and so I'm going to start first breaking down the California Health Department structure, and then we'll move on to the federal level, which is applicable to anybody in any state. California is one of the more highly regulated states in the nation, and so this is going to be a little bit more of an in-depth structure than other states. There are states like Ohio that don't even have a licensure process, and so you're essentially registering for a business license and notifying their health department that you exist and going straight for accreditation. There are other states like California that have an intensive licensure structure, and with this comes also an entire applications reporting structure and so on. And that's why it's very important to understand how this works so that you are not making silly mistakes and reporting things to the right authorities. So in the state of California, of course, the state of California is governed by the governor and the governor's office. Within that governorship, there are different departments and branches. So one of those departments is the California Department of Public Health, CDPH. CDPH runs all of the public health programs in the state that are state-based. For example, we have home health, we have hospice. If you're doing hospital stuff, you're probably applying there as well, and so on. Now, CDPH has a few different sections in there. First and foremost, we have CAB. This is the Centralized Applications Branch. Any kind of applications around your home health or hospice agency go to CAB. CAB processes applications for all major health programs for the state. Home health and hospice have their distinct branches in CAB, and each one of those branches has a handful of analysts. And so all of the applications, whether they're enrollment, change apps, whatever it is, are being processed by industry by a handful of analysts, like a max of 6 people or 7 people, and like a few junior analysts. Anytime you're applying anywhere in California for any kind of home health, hospice, SNF, hospital, whatever, those kinds of things, you're going through CAB. In CAB, their structure goes, there's supervisors, there's analysts, and then there's junior analysts. And they kind of change the way the work flows from time to time. But generally, when you send an application in CAB, the junior analysts get it first, do some kind of preliminary review, then there's some kind of fee payment, and then it goes to the senior analysts for a full review. And finally, once those analysts approve your application, it goes to a supervisor for kind of a sign-off. Now, CAB and CDPH are all audited by the governor's office. And so that's why it's very hard to overturn a denial of an application because it falls under audit of the governor's office. Now, besides CAB, we also have the various county health departments. This is the Los Angeles County Health Department, Orange County Health Department, Ventura County, whatever. Every county has their own health department. They are essentially in charge of the surveying of the state. Previously, in California, the health department did all of the surveys. Now, the health department actually contracts with accreditors to conduct all or most surveys. Pretty much besides complaint surveys, they're doing all of the surveys in California. This is licensure survey, focus surveys, like you've changed your ownership and now you have a survey, or you've changed your location, now you have a survey. The accreditors are typically going to be doing this if you are accredited under their jurisdiction. If you're not accredited by an accreditor, then you are under the jurisdiction of CDPH. And at that point, the county health departments will be conducting all your surveys. It is much harder to pass a survey from the county health department than an accreditor, regardless of which accreditor you go with. The reason is that the accreditors have kind of contract terms with the government, and they typically will tend to follow those contract terms, whether it's surveying checklists and stuff like that. County health departments often go above and beyond in their surveying, and because they are their own governing entity. And so they will fulfill whatever, contracting terms the accreditors have, but sometimes will just for example, the accreditors will usually not go beyond 3 days for a survey unless you have a big census. The health department can sit at your office for 5 days. Doesn't matter. It's up to them when they want to leave, come, go. They don't really have these same restrictions that the accreditors have. Next, under the accreditors, there's 3 companies that are allowed to do licensures and other surveys like that for the state. These are ACHC, CHAP, and TJC. TJC was JAGO. Now it's the Joint Commission. This changed a couple of years ago, so if you're used to hearing JAGO, this is TJC now. And so the accreditors now can conduct licensures, focus surveys, and so on. There are certain circumstances where you could opt for the health department surveying, but there are pros and cons. The pro of going with accreditors is they're going to go off of whatever their contract terms are, as we just spoke. The pro of going with the health department is that typically your survey's free. The accreditors will charge $1,000 or $4,000 to conduct the survey. So a lot of people who are super, super confident in their companies often will opt to go with the health department. That is not always an option that you can opt in or out of. The way that you opt in or out of this versus this surveying you is you have to cancel your accreditation, and then you fall under the state's jurisdiction. As long as you are accredited with somebody or in contract with an accreditor, the state will typically leave you alone. There are some cases outside of Los Angeles County, which is a very busy health department, that there will be some proactive surveying from the state, from the county health department. We've seen this a lot in OC, San Bernardino, Ventura counties, where they'll do, complaint surveys are always going to be the health department for the most part. There's a few tiny times when it's not, but usually the health department will handle the complaints. But in other cases, the county health departments will sometimes come and do provisional licensure surveys and things like that. So this is part of the enrollment process, and pretty much when you first get your license, it's for 6 months, the first license, and it's called a provisional license. So you have one provisional license for the first 6 months and another for the second 6 months. In between the 2 licenses, or right before you get your final actual license, not provisional, sometimes the county health departments will come and do a survey. Typically not in Los Angeles County because they're swamped and they don't have time for this kind of stuff. But in smaller counties, this happens pretty frequently, and this is a consideration of where to open your agency. And that's pretty much it for the state side of things and how the state runs the home health and hospice units in California. So on the federal side, we have a bit of a more extended structure, obviously. So first, on the federal level, you have the White House, right? So the whole federal government. And a branch of that is the Department of Health and Human Services that actually covers a lot of ground, not just healthcare. It's pretty much anything that affects your health falls under the Department of Health and Human Services. This is the cabinet position in the White House. A branch of this is CMS, the Center for Medicare and Medicaid Services. You're actually going to see, kind of like with our name, where we abbreviate THC, but we are the home health consultant, you'll see a combination of Department of Health and Human Services, 2 H's but 1 H abbreviation, Center for Medicare and Medicaid Services, 2 M's, 1 abbreviation. Don't let that confuse you. Typically, when people talk about CMS, you hear words like Medicare and things like that. That's what we're referring to. This is the branch of government, DHS, that rules the department, CMS. CMS contracts with 2 major private kind of companies to fulfill their program. First, they contract with accreditors, same list as California state contracts with. Now, the contracting with accreditors started something like 20, 30 years ago. Before that, the health department of your state did the surveys for CMS. So before contracting with accreditors, CMS would contract with the various state agencies to conduct whatever surveys they needed to conduct. In California, something like 25 years ago, whatever, JCAHO started appearing on the scene, or TJC, and doing accreditation surveys, meaning the surveys for Medicare. And so the three accreditors that are allowed to survey home health and hospice are, again, ACHC, CHAP, and the Joint Commission. If you are talking about other industries, like hospitals, there could be other accreditors that are licensed or contracted, whatever their terms are, to conduct these surveys. For the home health and hospice industry, it's these guys. Now, CMS also contracts with something called intermediaries. But pretty much these are regional contractors that CMS contracts with to process enrollment applications, process change applications, process billing. And so they are in charge of making sure that the billing goes through properly, audit the providers, and look for fraud, abuse, things like that. Now, the intermediaries then contract with various auditors, so like government agency, companies. They contract with other companies to conduct audits. These are your Clarence, your Levantas, these are your ZPIC audits, RAC audits, whatever, all these various ADRs essentially that you get. Any ADR that you get is contracted by your intermediary to review your claims and associated charting to find billing discrepancies, fraud, waste, abuse, improper billing, whatever. These guys get paid on a percentage that they can find and take back for Medicare. And so they're incentivized to find issues. Often, what happens with these guys is that they will review charts. Any tiny issue will become immediately a claim payment denial. You then probably have to go through rounds of appeals, depending on how big the issue is, to get a second opinion, a third opinion, whatever. The process is really complicated and it's long to get any kind of appeal overturned for a billing audit denial. Sometimes it's worth it, sometimes it's not. But essentially what happens is they make money on the percent that they can take back from Medicare. And so it by default will be a complicated process. The final kind of piece of the federal government structure is the OIG. The Office of Inspector General is a department of the federal government that's tasked with finding fraud, waste, abuse within the federal government and also within anybody that they're contracted with. And so that includes these guys, these guys, these guys, and providers. Typically, if you have issues with the OIG, you have big issues. This is essentially the government agency version of the FBI. It's kind of like that. Now, a quick disclaimer about all of this information, especially as it relates to contractors and things like that. These guys can change. I've been in this industry for like 20 something years and it's always been NGS. Like it's never been anybody different. But like some of these other ones have changed in the 20 something years I've been in the industry. So these are essentially like private or maybe nonprofit companies that are contracted to perform various services. And they can win and lose contracts based on a number of things. And so every time the contracts are up for renewal, they have competitors that are trying to get into the contract. And so this list can change, this list can change, even this list can change. And so we are filming this in November 2024. As of November 2024, this is the structure, but it can change based on essentially contractor swapping. And also another change that has happened, as I've stated earlier, is that, again, this is a contracting thing, but still, that CMS used to contract with CDPH in California, and specifically the county health departments were tasked with this, to conduct all surveys. Now it's accreditors. So these structures can change, but it's important to generally understand what it is we're dealing with. And that is the federal structure of the home health and hospice industry. So if you enjoyed this video, please like, share, subscribe for more of our content. And again, this is Mariam Treystman from the Home Health Consultant. Thank you. Bye.